Rising numbers in Alberta are straining the system. There were 20 new deaths reported in that province today and more than 860 new cases in 24 hours. The positivity rate is 7% now, and there are so many active cases, contact tracers can't keep up. Alberta doctors have pleaded with Premier Jason Kenney to impose tougher restrictions, but as Heather Yourex-West reports, some Albertans are now taking matters into their own hands.
For weeks, Alberta's Premier has been clear. Protecting lives and livelihoods is the reason why a lockdown needs to be avoided at all costs. But at least one Calgary business owner says he's shutting down anyways. The owner of Dickens Pub shared this on Facebook Sunday. "We are going to close for 2 to 3 weeks. I care about my staff and my customers, and it feels wrong to keep inviting everybody down here with the case numbers spiking badly."
I feel like a tsunami siren is wailing.
The head of Calgary's Emergency Management Agency believes there is no time to waste, calling on the province to shut down all but essential businesses for 28 days.
It's my job. It's not popular. It's my job to tell people when I think that we've reached a tipping point. And that's where I feel we're at right now.
But on Sunday, Alberta's Premier continued to ask Albertans to do the right thing on their own.
These are relatively modest measures, and I really hope that people respond positively, because if not, we'll have no option but to look at more restrictive measures down the line.
Under Alberta's Public Health Act, only the provincial government has the authority to implement a lockdown. Public health officials can only offer advice.
If you publicly disagree with the government, you split the leadership right at the very moment that communities need clear leadership.
Dr. James Talbot was Alberta's Chief Medical Officer of Health between 2012 and 2015. He says when there is a disagreement with government, it's often best for public health officials to continue working quietly behind the scenes in the hopes of gaining allies and changing minds. But he also warns that after a successful spring and summer, the situation in Alberta has become very serious. And without action, ICUs in the province could be overrun in just a few weeks' time.
It's the last period and there's a surge happening, and we have to clamp down on defense, and we have to play every shift as if lives depended on it, because they did.
Heather Yourex-West, Global News, Calgary.